More distal bone of the hip joint, let's consider the bony landmarks which are found on the femur. Ones that you should be aware of are the which are found for screen. Some X-ray image found on the bottom left of this screen. So if we look first at the more distal bone of the hip joint, let's consider the bony landmarks which are found on the femur. Ones that you should be aware of are the head of the femur, so this is the ball of the ball and socket joint. A greater trochanter located superiorly and a bit anteriorly, and the lesser trochanter, which is located posteriorly and inferiorly relative to the greater trochanter. And then on the posterior shaft of the femur is the linea aspera. And each of these bony landmarks are going to be important places of muscle origin and insertion. And each of these bony landmarks are going to be a shaft of the femur. And on the posterior shaft of the femur is the linea aspera. And each of these bony landmarks are going to be important places of muscle origin and insertion. Looking then at the more proximal bone of this joint is the pelvic bone or the pelvic bones. There are three different regions of the pelvis that we'll consider, and in children, these three separate regions are actually separate bones. But by the time we get to adulthood, these bones have fused. We have a left pelvic bone and a right pelvic bone, and these two, left and right, do meet anteriorly at the pubic symphysis, and they meet posteriorly. Both will join into the sacrum. So collectively, the right pelvic bone, the left pelvic bone, the sacrum. This forms a ring of bones, which is known as the pelvic girdle. So this superior portion circled here of our pelvic bone, this is the ilium. Then the ischium will be the portion of the pelvic bone that is located posteriorly as well as inferiorly. Again, this occurs on the right as well as on the left. I only have the right pelvic bone location circled here. And then the pubis, again, it's found on both the right and the left, and it is located anteriorly as well as inferiorly. And again, both of the pelvic bones together on the right and the left, along with the sacrum, make up our pelvic girdle. This image here also, along with the sacrum, make up our pelvic girdle. Will be the portion of the pelvic bone that is located posteriorly as well as inferiorly. Again, this occurs on the right as well as on the left. I only have the right pelvic bone location circled here. And then the pubis, again, it's found on both the right and the left, and it is located anteriorly as well as inferiorly. And again, both of the pelvic bones together on the right and the left, along with the sacrum, make up our pelvic girdle. This image here also does a nice job of showing these three regions of the pelvic bones. In gray is the ilium. In the darker pink color is the ischium. So you can see it is inferior and on the posterior aspect. And then also inferior, but on the anterior aspect, shown in light pink, is the pubis region. We can identify further bony landmarks besides these three different regions of the pelvic bone as well. And again, these are going to be important points. We'll talk about them again when we discuss the movements which occur at the pelvic girdle, as well as muscle attachment points. So iliac crest, we've actually already talked about this just really briefly when we were looking at some of the muscles that have action at the shoulder. The iliac crest is going to be located superiorly along the ilium. And indeed, all along the very uppermost portion, so the most superior region of the ilium, we have this iliac spine. There is an anterior superior iliac spine, an anterior inferior iliac spine. So remember, anterior is towards the front of the body, superior is higher, inferior is lower. And we also have a posterior, superior, and posterior, inferior iliac spine. So just referring to the different regions along this upper rim of bone. Looking then at the ischium, the ischial tuberosity. Again, we have one on the right, one on the left, and you might know these as your sit bones. So when you sit down, the bony region which comes into contact with your chair, that is your ischial tuberosity. And then where the three regions of the pelvic girdle meet together, the ilium, the ischium, and the pubis, on the lateral aspect is the acetabulum. And this is the socket of that ball and socket joint, which together makes up our hip joint. So the head of our femur will fit right here into the acetabulum, one on the left, one on the right-hand side of our body. And this brings us to the end of the first portion of the lecture. On the right-hand side of our body joint. So the head of our femur will fit right here into the acetabulum, one on the left, one on the right.
If she ain't staying, I'm geek to the. If she ain't staying, I'm geek for the rest of the week. If she ain't staying, I'm geek for the rest of the week.
Hello, everybody. This is the second lecture associated with Chapter 8. In this portion of the lecture, we're going to talk about the joint itself, so the hip joint as well as the pelvic girdle joints. and then the movements which are associated with these two regions of bone. So looking first at the hip joint, it's a ball and socket joint, and it's made up of the ball, so that's going to be the head of the femur, shown very nicely here. And it fits into the socket, which is the acetobulum found on the lateral aspect of the pelvic girdle. Unlike the shoulder joint, this is a fairly deep connection, and this does improve the stability of the joint. Even though it is a stable joint, it's still a ball and socket joint, and so it has a great deal of movements available. So we're going to look at movements in all three planes, as well as some combination movements. In the sagittal plane, we have flexion and extension as per usual. So with flexion, you can think of moving of our lower extremity towards the anterior, and extension will be either a return from flexion towards our neutral position, or we can have extension past neutral as well, so movement towards the posterior. We also have movement in the frontal plane, abduction and adduction. So adduction, think adding the limb back in, so moving the limbs together or more medially, adduction, and abduction, abduction, moving the lower leg away from the body. In the transverse plane, we have internal rotation and external rotation. The image here of the figure that is shown prone, it does have the knee flexed, but this is just to help illustrate the internal and external rotation which is occurring at the hip. So the movement of the hip occurs independently of what the knee is doing. And you can see that a little bit better when we look at the supine version here. So external rotation, have some imaginary anterior point on our thigh, moving away from the other leg. Internal rotation, it's going to rotate inwards towards the inner thigh, medial. And a combination movement, so if we think about the diagonal plane, diagonal abduction is going to be movement away from the body, from the midline of the body in the diagonal plane. Diagonal adduction is adding that limb back in towards the rest of the body in the diagonal plane. Movements at the pelvic girdle. So the prior two slides, fairly straightforward. We've seen ball and socket joints before. We can think about how we can move our hips. Movements at the pelvic girdle are a bit more subtle and a little bit more difficult to understand. So the pelvic girdle does differ. The movements at the pelvic girdle do differ from other movements that we've talked about so far. One key is to remember that the pelvic girdle is a ring of bone. So again, on the posterior, we have the sacrum. We have our right pelvic bone and our left pelvic bone, and they meet anteriorly at the pubic symphysis. So it's going to behave as a ring. That means if one portion of the pelvic girdle moves, the other portions of the pelvic girdle have to move as well. The book emphasizes this point by using an analogy of the steering wheel for a car. So if you think about moving the steering wheel of your car, all of the movements that you have are rotational movements. And so similarly with the pelvic girdle, all the movements we'll look at are going to be rotations of the pelvic girdle. And again, with the steering wheel, a movement on one side of the steering wheel will also move the rest of the steering wheel. So if you're rotating your car to the right, or you're rotating the steering wheel to the right, your right hand may move the right side of the wheel downwards, and what happens to your left hand? It's going to move upwards. So opposite action occurs on the opposite side of the ring of bones. And we're again going to see something similar with the pelvic girdle. However, the pelvic girdle, unlike the steering wheel analogy, it can move in all three of the planes, so not just a sort of right-left twisty movement. We're also going to have rotation, which occurs anteriorly and posteriorly, as well as some lateral rotations. And of course, it's not actually the bones within the pelvic girdle that are rotating. So this isn't a joint movement like we've been learning about. Rather, the pelvic girdle movements occur from motions at the hip as well as from the lumbar spine. And then one final point just to keep in mind while you're learning these movements is that each movement is going to be from the perspective of the person's pelvis that is actually moving. So when you're looking at an image on a page, remember to mirror the sides of the body that you're referring to. So looking at the page is going to be the person's right hip or right pelvis, or the person you're looking at's left hip, left pelvis. So reverse your right and your left. So to begin with, the first two movements are going to be anterior and posterior pelvic rotation. So again, remember that what happens on one portion of the pelvic girdle will move the rest of this ring of bones as well. So with anterior pelvic rotation, this is also known as anterior tilt. The iliac crest, so this upper portion of our ring of bones, is going to tilt forwards or tilt anteriorly. What happens when this happens is the pubic symphysis, located in the anterior region of the pelvic girdle, moves inferiorly, and this causes the sacrum and the posterior of the pelvic girdle to move superiorly. Posterior pelvic rotation or posterior tilt is the exact opposite motion. You can think of the iliac crest. So if you have your hands on the top portion of your hips, rotating that backwards or posteriorly will cause the sacrum, located in the posterior aspect of the pelvic girdle, to move inferiorly and the pubic symphysis to move superiorly. So anterior pelvic rotation, the front or the anterior of the pelvis moves downwards. And in posterior pelvic rotation, we're going to rotate posteriorly. The posterior portion of the pelvic girdle rotates down and back. The next two movements are going to be the lateral pelvic rotation movements. Left lateral is going to be where our left pelvis moves inferiorly relative to the right pelvis. So this is, if you're raising one hip above the other hip and standing, this is the motion that you're doing. Left lateral pelvic rotation would be when your left hip drops down relative to your right hip. So in other words, your left pelvic bone is moving inferiorly, right pelvic bone is moving superiorly then. Right lateral pelvic rotation is the exact opposite motion. In this case, the right pelvis will move inferiorly relative to the left side of the pelvis. So again, think about cocking one hip up or cocking one hip down. whichever of your hips is moving in the inferior direction will be the direction you signify as a lateral pelvic rotation. So left lateral pelvic rotation is what is shown in this image here, as her left hip is moving inferiorly. And then these are probably the easiest two movements to understand, the left and right transverse pelvic rotation. These are twisting motions. So if you can imagine twisting at your waist, say you want to turn around and look behind yourself. Left transverse pelvic rotation will be a rotation of the pelvis towards the body's left. So when this happens, your left pelvis is going to move posteriorly, and the right portion of the pelvis is going to move anteriorly. And then the right transverse pelvic rotation will be the exact opposite motion. We're going to have the right portion of the pelvis move towards the body's right, so it's going to be in right axial joint. Hello, everybody. Hello, everybody. Welcome to the third lecture for Chapter 8. And in this portion of the lecture for Chapter 8, we're going to be talking about the muscles. As with other joints, the location of the skeletal muscles that are surrounding the joint are related to that muscle's action at the joint. Muscles of the hip joint originate on the pelvis, and they will insert below the hip joint. So remember, to have action at the hip, the muscle must cross that hip joint. It must have an origin point superior to the hip joint and an insertion point inferior to the hip joint. We can think about those muscles which give us hip flexion, so that anterior movement in the sagittal plane, and these are going to be located anteriorly. Hip abductors, swinging our hip out to the side in the frontal plane, are going to generally be located laterally. Hip extensors are going to give give us the ability to move our leg posteriorly. These are going to be located on the posterior aspect of the hip joint. And our hip adductors are going to be located medially. We can also make some general statements about where the muscles we can also adductors are going to be located medially. We can also make some general statements about where the muscles, having common actions, generally they're going to have similar insertion points as well. So our external rotators involved in rotating our hip externally, these generally have an insertion point at their greater trochanter. Our hip flexors typically insert on the lesser trochanter. This is a posterior view of the skeleton we're looking at here. Our hip adductors will insert on that linea aspera, so that line on the posterior aspect of the shaft of the femur. And one more thing to keep in mind, a lot of the hip muscles are biarticular muscles, so they have actions at the hip, but they also have actions at the knee as well. So some will insert somewhere on the femur, so just have actions at the hip, but many of these biarticular muscles, they must insert below the knee as well. So they're going to insert on the patella, the tibia, or the fibula. This is a list of the skeletal muscles that have action at the hip, and we're going to discuss most of these in this class today. The biceps femoris, the semitendinosus, and the semimembranosus, so these are our three hamstring muscles. And you see that they have an asterisk next to them. So we're going to talk about these muscles with chapter 9. It's not that they're not important with their action at the hip joint, but we have a lot of muscles to go over with the hip, so we'll add these to our chapter 9 muscles with action at the knee conversation. I've grouped these muscles based on their location, so those which are found in the anterior or posterior of the hip, lateral or medially located. And as you can see, these locations then are associated with an action that the muscle might have. But one thing to keep in mind is that not only is the location of the muscle important for determining the muscle function, but we also need to determine what is the most stable body structure. This is always true when you talk about a given action of a skeletal muscle, but it is less important to these consider when we were looking at muscles of the upper extremity, because with our upper extremity, typically our origin points were also the more stable of the region. However, with our lower extremity muscles, very often the insertion point of the muscle is actually more stable than the origin point of the muscle. And so we almost need to flip our thinking about which end of the muscle is moving during concentric contraction. So when you are standing up, your weight is fully on both legs. Well, now your legs are going to be a lot more stable than your trunk. So for example, if we look at muscles in the anterior, generally involved in hip flexion, as I have listed here, this is true if the leg is unloaded. So perhaps you have all of your weight on one leg, and then you can certainly flex your hip on your unloaded leg. Perhaps you're lying down or sitting down, then it's very easy to have hip flexion where the insertion point moves closer to the origin point. However, if you are standing up and you have weight on both of your legs, now the insertion point does not want to move as easily as does the origin point. In this case, when we concentrically contract that muscle, now the origin point is going to be pulled closer to the insertion point. So rather than hip flexion, we're going to have anterior pelvic rotation and perhaps some lumbar flexion as well. This is a superior cross-section of the thigh, and it's just to illustrate the muscles which are located anteriorly, so our anterior compartment. Posteriorly, we have our hamstring muscles, which we'll talk about in the next chapter, and then the medial compartment, so generally our adductor muscles. All right, so then looking at each muscle individually, we'll begin with those which are generally located in the anterior aspect of the joint. The first we'll discuss is the iliopsoas, which actually is not a muscle at all. So the iliopsoas is a muscle group, and it is the combination of the iliacus and the psoas major. And if you happen to have one, the psoas minor. So not everybody has a psoas minor muscle. There doesn't appear to be any functional difference to having a psoas minor or not. So iliacus is definitely one, and also the psoas major together make the iliopsoas muscle. This muscle collectively originates on the ilium and the lumbar vertebra, and it inserts on the lesser trochanter and a bit of insertion points along the pubis as well. If we think about its actions at the hip, so when the leg is not loaded, it is not bearing the weight of the body, then the insertion point can be our more mobile end. Concentric contraction, we're going to move this insertion point towards the origin point, and that gives us hip flexion, as well as a bit of external rotation. However, if we think about its action when our weight is on our leg, now our insertion point is going to be the more stable of the ends of the muscle, and our origin points are going to move more easily. So in this case, the origin points are going to be drawn down towards the insertion points, and this gives us anterior pelvic rotation. And if we activate just one of our iliopsoas, so say your right iliopsoas, that will give us transverse pelvic rotation, so a twisting action of our pelvis. You would use this muscle if you're doing a supine leg raise, so you're laying on your back on the floor and you're lifting your legs up. So that would be one use for this muscle. Anytime you're trying to do a sit-up where your hips are not properly flexed, really you're going to be working your iliopsoas muscle more so than your abdominal wall muscles. The rectus femoris is also located in the anterior aspect of the thigh. The rectus femoris, abdominal wall muscles. So when you're trying to do a sit-up where your hips are not properly flexed, really you're going to be working your iliopsoas muscle more so than your abdominal wall muscles. The rectus femoris is also located in the anterior aspect of the thigh. This is one of our four muscles which together make up the quadriceps muscle group. The rectus femoris is the only one of those quadriceps that does have actions at the hips. It originates on the anterior inferior iliac spine, and it's going to insert down below at the patella, and then really with the patellar tendon, it's going to insert with the rest of the quadriceps into our tibial tuberosity, as we'll look at in more detail in chapter 9. So actions at the hip, it's an anterior muscle, are going to be hip. Going to be working your together make up the quadriceps muscle group. The rectus femoris is the only one of those quadriceps that does have actions at the hips. It originates on the anterior inferior iliac spine, and it's going to insert down below at the patella, and then really with the patellar tendon, it's going to insert with the rest. To the quadriceps into our tibial tuberosity, as we'll look at in more detail. Very powerful muscle at raising your leg out in front. They're going to be hip flexion. So again, unweighted leg, let's say you're kicking your leg out in front of you, rectus femoris muscle would be a very powerful muscle at raising your leg out in front. However, if your weight is firmly planted on both of your legs, then it's going to give us that anterior pelvic rotation. So remember, anterior pelvic rotation, the front portion of your pelvis, so your pelvic girdle, your pubis region is going to move inferiorly, whereas the sacrum, that posterior region, is going to move superiorly, so a forward tilt. This muscle is going to be used with the quadriceps group, so any sort of powerful locomotion type activities, running or jumping. And again, we'll look at it in a lot more detail in chapter 9. The sartorius is also a muscle which is located in the anterior. Sometimes it's been, or previously it was called the tailor's muscle. So I have a picture of an old-timey tailor on this screen to help you remember that, the sartorius. It is a muscle which appears quite easily when you are sitting cross-legged, or if you're doing the butterfly stretch. Really, this muscle is one of those that you can see or feel during the butterfly stretch. The origin point is going to be up in our pelvis, so similar to the muscle we just looked at, anterior superior iliac spine now. And it's going to insert down below the knee. So that should tell you right away that this is a biarticular muscle. It's going to have actions at the hip, and we'll look at it again with chapter 9 with its actions at the knee. So if the leg is unweighted and we want to just think about its actions at the hip, then the insertion point is going to move towards that origin point and give us hip flexion. And as you can see, there's a little bit of a diagonal arrangement of this muscle where its origin point is a bit lateral relative to its insertion point. And so this also gives us a bit of ability for abduction or external rotation. However, if our weight is on our legs and we hold our insertion point to be the more stable end, then the origin point is going to be pulled down towards the insertion point. And so this gives us, again, that anterior pelvic rotation. If you want to prevent doing that, engage the abdominal muscles, and that will help hold the pelvis. Region more stable. This muscle is fairly weak at both actions of the hip and the knee at the same time. And it's a similar story for the rectus femoris, which we just looked at over here. So it can have actions at the hip and the knee, similar to the sartorius, can have actions at the hip and the knee, but they're not going to be fantastic at doing both at the same time. And that has to do with the optimal muscle length. So remember that for maximum tension development, a muscle likes to be at 100 to 130% of its resting length, concept we covered back in chapter 2. For the rectus femoris, we flip back to that one. If we have hip flexion, the muscle is not going to be as effective at knee extension because it's beginning from a slightly shortened and already contracted position. And it's similar with the sartorius. If we already have our hip flex, it's not going to be as good at knee flexion because we're beginning from an already contracted position. The next muscle on our list is the pectineus. So acts as both an anterior muscle as well as a bit of a medial muscle. As you can see, it originates on the pubis region of our pelvic girdle. And it inserts relatively closely, so on the upper portion of our femur. It is a short muscle, so not necessarily the strongest or most powerful muscle of our hip region. each have a see it originates on the pubis region of our pelvic girdle, and it inserts relatively closely, so on the upper portion of our femur. It is a short muscle, so not necessarily the strongest or most powerful muscle of our hip region. At the hip, so again, if we assume that our origin point is the more stable, then it's going to assist with flexion. It's also going to assist with other medial muscles and adduction and external rotation as well. On the other hand, if our insertion point is more stable, then it's going to give us that anterior tilt, similar to our other muscles, which are located in the anterior region. The next three muscles are nicely named. They all have the word adductor in the title, giving you a really good clue as to their function. And then they each have the second portion of their name is each going to be related to their size. The adductor magnus, so think magnificent or of great magnitude. So it's going to be a very large muscle, which gives us adduction. And as you can see here, it's one of many muscles which are located in the inner thigh or the medial region of our upper lower leg, of our upper lower extremity. This muscle originates on the pubis, and it inserts along the linea aspera on the posterior aspect of the shaft. So origin point located a bit more anteriorly, insertion point located a bit more posteriorly. So that helps explain why this muscle gives us a bit of external rotation. Its main role is in adduction, so drawing the leg together. It can also assist with some posterior movement as well, so assist with that extension of the hip. The adduction and that will help. It's not going to be as good at knee muscles. Muscles origin point is the more stable, then it's going to assist with flexion. It's also going to assist with other medial muscles and adduction and external rotation as well. On the other hand, if we have very anterior with that adductor is the adductor of our femur. Now it's inserted with that extension of the hip. The adductor brevis, again named for its action. Brevis, think brief, so this is a relatively short adductor muscle. It also originates on the pubis region, and it's going to insert along the upper shaft of our femur. Now it's inserting on the medial anterior region, not posteriorly. So this muscle is involved in adduction as well as in external rotation. And then our third adductor is the rotation.